Hello everyone, and welcome back to GP Made Easy, home of medical summaries for healthcare workers, patients and everyone alike. I hope you've had an amazing week. My name's Dr. Daniel Follows and I'm a fully qualified GP living and working in the UK. So now we're moving on to the Endocrinology series, and we'll be starting off with thyroid disorders, and especially today we'll be covering hyperthyroidism, or overactive thyroid as it's more commonly known. But before we do, don't forget to like, comment and subscribe so I know that you're enjoying this content. But anyway, on with the video. So first of all, a bit of background information. So up here, I've got a diagram of what the thyroid gland looks like, and it sits just around here, just around the same level where your larynx/voice box is. Now it's a gland that secretes hormones that helps with metabolism, energy use, growth and temperature regulation. Now hyperthyroidism is when this gland overproduces and oversecretes the thyroid hormone. So I've got another diagram up here showing what the normal process is like. So normally if the hormone needs secreting, the pituitary gland, which sits in your brain, secretes a secreting hormone called TSH, and then this normally goes to the thyroid gland to tell it to produce and secrete the hormone. So later on we'll cover on what this may look like on your blood test results when it's abnormal. Now hyperthyroidism is the term when the gland is secreting increased amount of hormones, but there is another term called thyrotoxicosis, which is the term used for the clinical manifestation of hyperthyroidism, which is the signs and symptoms, which we will cover later. Now the prevalence, which is the amount of people who have the condition, is estimated to be about 0.2 to 1.3% worldwide. Okay, so now on to causes. So the commonest cause, which counts for 80% of cases, is a condition called Graves' disease. And this is an autoimmune condition where your body's immune system just attaches to the thyroid gland and encourages it to make more of the thyroid. Now, it's more common in people aged 30 to 50, and it's unfortunately more common in women. Another cause is called toxic multinodular goiter, and this is where there are lots of nodules on the thyroid gland that encourage it to keep increasing thyroid hormone production. It is a benign condition and tends to occur more in iodine deficient areas. So the next cause is a toxic thyroid nodule, or adenoma as it's more commonly known. And this is just a nodule that sits on one side of the thyroid gland. It accounts for about 2% of cases, and it's more common the older you are. Another cause is a TSH producing pituitary adenoma, and this is a rare tumour that sits in the pituitary gland and secretes excess levels of TSH. Another condition is pituitary thyroid resistance syndrome, and this is a rare condition caused by increased levels of beta-HCG, which is more commonly known as the pregnancy hormone. So this tends to occur if someone has gestational thyrotoxicosis, especially in their first trimester of pregnancy. If the pregnant woman has hyperemesis gravidarum, which is excess vomiting, or it just happens if someone has a beta-HCG secreting tumour. Excess iodine can cause hyperthyroidism, and this is more common in people who take medications such as amiodarone, or people who take kelp supplements, or people who have recently had any imaging done that's involved having contrast. And the final condition is thyroiditis, which is a transient autoimmune condition, and it can occur either postpartum, or there is another condition called de Quervain's, which is temporary autoimmune response caused by a recent viral illness. So now moving on to risk factors. So risk factors include if you are female gender, if you have a family history of hyperthyroidism, if you smoke, and also if you have history of another autoimmune condition such as type 1 diabetes. Okay, so now moving on to symptoms and signs. So for most people it's caught incidentally on a blood test, but some of the things they may present with include fever, malaise and thyroid pain. They may get shortness of breath, or they may notice their voice goes hoarse. They may have dysphagia, which is difficulty in swallowing food or liquids or both. Or they may notice the thyroid is causing a pressure feeling on their neck. They may feel agitated or have insomnia, which is difficulty in sleeping. They may have emotional lability. They may be irritable or anxious or have palpitations. They may have exercise intolerance or feel fatigued or feel weak. They may have heat intolerance or have increased sweating. May have increased appetite with weight loss and diarrhea. They may have fertility problems, or women may notice they have decreased periods or no periods at all. Patients may go to pass urine more often, or find that they have increased thirst. People may have a generalized itch. In men, they may also notice decreased libido and notice something called gynecomastia, which is where breast tissue develops. In diabetics, they may notice their sugars just suddenly increase and they find they're having difficulty controlling it. Now, some of the signs you may see, this patient may have a tremor, which is just shaking. They may have something called palmar erythema, which is just redness in the palms of your hand. Put a diagram of it up here. They may have an increased heart rate. They may notice edema, which is where fluid builds up on the legs. You may actually see an enlarged thyroid gland on the neck, or goiter as it's more commonly known. And I'll put a diagram up here. Or you may notice something called proptosis, which is where their eyes looks like they're popping out. And I'll pop a diagram up there. Okay, so now moving on to diagnosis, and it's mainly diagnosed by a blood test called the thyroid function test. So, put the diagram up from earlier, which shows the whole how the pituitary gland stimulates the thyroid. So in hyperthyroidism on the blood test, they have increased T3 and T4 levels because the thyroid gland is secreting that. But they have a low TSH level because your body is trying to respond and turn that gland off. The only time this is different is when there is a pituitary secreting tumour, where both the TSH and T3 and T4 are raised. So now moving on to management. So first of all, if you suspect someone has thyrotoxicosis crisis, where they're quite unwell from this, you would admit them into hospital straight away. But for most patients, you would refer them to see the endocrine specialist, and it would be done on an urgent basis. If patients are really struggling with the symptoms, especially tremor, palpitations, feeling anxious, then you can prescribe a beta blocker in the interim to help just get on top of those symptoms. Now, while they're waiting to see the endocrine specialist, the specialist may actually advise the GP to start a medicine called carbimazole, and this essentially just decreases thyroid hormone production. Unfortunately, one of the serious side effects from this is it can affect your bone marrow. So we tell patients that if they notice anything like fever, malaise, coughs, colds, sore throats, if they've got mouth ulcers, to present to their GP straight away, as they will need a full blood count check just to make sure their bone marrow hasn't been affected. Now, just onto another note about people who are planning to get pregnant or are pregnant. So first of all, if they're planning to get pregnant, we advise them to get in touch with their GP as soon as possible so we can get them in touch with their endocrine specialist. And if someone is already pregnant, then you need to get them referred in straight away so they can get that specialist care during the pregnancy. Well, that's it for today's video. I hope you found it helpful and learned something new. Don't forget to like, comment and subscribe so I know that you're enjoying this content. And if there are any topics you'd like me to cover in future, then please comment down below. I also post more regular, shorter videos on YouTube Shorts, TikTok and Instagram. They're just up in this corner and it's the same name, it's GP Made Easy. Or I also have an email address that you can contact me on, and it is just up here. Well, I hope you guys have an amazing week and I will see you in the next video. So, I thought I'd read this Bible verse today for everyone, as I've read it today and it's quite encouraging. So it's Psalms 41, and I'm going to read the first 3 verses. Blessed by God's grace and compassion is he who considers the helpless. The Lord will save him in the day of trouble. The Lord will protect him and keep him alive, and he will be called blessed in the land. You do not hand him over to the desire of his enemies. The Lord will sustain and strengthen him on his sickbed. In his illness you will restore him to health. Well, I hope that's encouraged you guys, and I will see you in the next video. If you can't wait till then, I've got some more videos just up here. Have a click and watch of them. And guys, don't forget to hit that subscribe button so you don't miss out when the new videos do come out. Well, have a good one, guys.